If you're struggling with the side effects of tamoxifen and you don't know where to turn for help, this is the only video you need. I've had to take tamoxifen myself for breast cancer and I know just how hard it can be. Today, I'm going to tell you how to cope with everything from hot flushes, night sweats and brain fog to vaginal dryness and loss of libido. I'll give you a list of questions you can ask your doctor if you are finding it tough. I'm Dr. DrLizORiordan, the breast surgeon with breast cancer, and I do the research so you don't have to. Make sure you hit the subscribe button so you don't miss my next video. And as a special bonus at the end, I'll let you into a secret tip that just might help when everything else fails. So first of all, why do you get side effects? Before I get into the nitty-gritty, I wanted to remind you why tamoxifen causes menopausal side effects, and it's because it stops your breasts absorbing estrogen. That means that the level in your bloodstream falls. Now this happens naturally at the menopause when your ovaries stop producing eggs. The only difference is that with tamoxifen, it happens in 2 to 3 weeks instead of 2 to 3 years. And it can be one hell of a wake-up call. One day you're fine and the next you're a sweaty, sweary, irritable mess who can't remember where you left the house keys. I've been there. It's important to remember that although there are hundreds, if not thousands of women online posting about their struggles with tamoxifen, there are just as many more who have found it easier to cope, but they can't be bothered to tell the world on social media. Generally, the symptoms do fade after the first 6 to 12 months, but some women, like me, will struggle for 5 or more years. So why doesn't your doctor recommend HRT? Because your cancer is ER positive, estrogen stimulates breast cancer cells to grow. After your surgery, when the cancer's been removed, there may still be cancer cells in your bloodstream that are sleeping. And one day, they may decide to wake up, find a friend, and start to grow and move around the body. Your doctor is treating you with tamoxifen to lower your levels of estrogen and stop this from happening. It doesn't make sense to take HRT, which will increase your estrogen levels and potentially increase the risk of recurrence and an early death from breast cancer. All the international guidelines state that systemic hormonal replacement therapy, or HRT, is not recommended for breast cancer patients, and it should only be used as a last resort when everything else has been tried. And that includes talking to your oncologist about having a treatment break for a couple of months, trying a half dose of tamoxifen, or even stopping it completely if you have a low risk of recurrence and are willing to take that risk. When HRT is off the table, it does mean that it's harder to treat your menopausal symptoms, but there are lots of options that can help. But if you've tried all of these options and you're still suffering with severe symptoms, particularly those that might affect your mental health, it might be worth discussing HRT with your oncology team. So let's start with the practical things that can help with the symptoms before I move on to the alternatives to HRT. Sleep. This can be a thing of the past when you get night sweats. I'd wake up every hour dripping in sweat and then shivering as the sweat dried. In fact, I thought I'd wet myself the first time I had one, as I felt a trickle of fluid run down my inner thigh. Tossing and turning all through the night meant I was exhausted in the day, and there didn't seem to be an end in sight. My top 5 tips are: number 1, wear sweat-wicking clothes in bed if you don't want to sleep naked. Running tops dry really quickly and can help you get back to sleep. Number 2, separate duvets. This was a game changer for my husband as he no longer woke up with the duvet on the floor. Plus, I can have a lightweight summer one and he can have a heavy winter one. I do miss the intimacy of sleeping under the same duvet, but it's really helped the night sweats, especially in the summer. Number 3, chill pillows. You can get these from places like Amazon. They are always cold for you to cool your head down when you wake up. Number 4, try a fan or a water spray. I taught myself to stop getting flustered and just stay still, as I knew I would eventually get off to sleep again. My sleep was less broken and I wasn't as aware of the flushes. And finally, number 5, exercise. On those days where I've worked out really hard, I am so tired that I pass out in bed and sleep right through. Now, what about hot flushes? I used to describe these like a reverse orgasm. You can feel it coming, but you really don't want it. These are my top 5 tips to help. Number 1, wear loose, light layers. Polar necks will become a thing of the past. I needed clothes I could get on and off easily without flashing people in public. Number 2, carry a small fabric or a battery-operated fan in every handbag. I've even seen ones that are powered by your phone. Number 3, avoid dietary triggers. Most women find that they get worse when they eat spicy food or drink caffeine and alcohol, and it might be worth experimenting to see if that curry or gin and tonic is really worth it. Number 4, it's exercise again. It can help reduce the number of hot flashes you get. And number 5, think about the makeup you wear. You might want to try a powder foundation or setting your makeup with a finishing spray to stop it running during the day. Brain fog. God, this is so frustrating. If you've had chemotherapy, you may find that you think differently as it can cause brain damage. I still can't do anagrams anymore, and it's been 8 years since chemo and I still get words confused. I'll call an orange a potato and it drives me and my husband mad. The lack of sleep from the night sweats adds to it, and then there's the brain fog that comes from the menopause. These are my top 3 tips to help. Number 1, accept that you might need to do things differently. You might never get your brain back, and you have to get over this before you can move on. Number 2, give yourself more time to do things. I really struggled when I realised I couldn't multitask anymore and I have to write everything down, but doing it has been a huge game changer. Don't rely on remembering something in a few hours' time. And number 3, doing puzzles can help. Crosswords, Wordle, Sudoku, it helps keep your brain active. What about complementary therapies? Many cancer centres now offer these that can help with hot flushes and night sweats, such as acupuncture, and some breast care nurses are trained to do them. I've tried both of them and they did help a little, so it's worth asking locally if you can get this on the NHS. What about counselling? So some cancer centres will have trained psychotherapists that offer cognitive behavioural therapy, also called CBT, that can help you learn to adapt and cope with your menopausal symptoms. And this has had some really good results in trials. It's been shown to reduce the symptoms by 50% after a course of just 8 weeks. Now, I haven't tried it myself, but it's worth investigating. Are there any alternatives to the HRT? Yes, there are. Now, sadly, your GP, your oncologist or your breast surgeon may not know about all of these, and I didn't when I was working as a breast surgeon, but the British Menopause Society have a leaflet on their website that you can download and take to your doctor, and it lists all the drugs that can be used to help with the hot flushes and the night sweats. I'll put a link to that leaflet in the description at the bottom. All these drugs are normally prescribed for other conditions, like antidepressants, anti-epileptic tablets and painkillers, but because of the way they work, they can also help with the hot flushes and the night sweats. You are not being given them because your doctor thinks you're depressed. These are the drugs that can help with the hot flushes: gabapentin, pregabalin, clonidine, venlafaxine, citalopram and oxybutynin. And now I'm going to get to the good stuff. What about your libido? This is one of the really cruel side effects of tamoxifen. It lowers your libido or your sex drive because you have less estrogen. You can still physically climax, but you might never be in the mood to do it. This is where regular masturbation can help. You may need a different sort of stimulus in a different area, and using a small vibrator can really help you get to know what works for you now. And remembering how good it feels once you get going might help you initiate foreplay with your partner. Remember that penetrative sex isn't the only option for intimacy. Maybe take it off the table and connect through massage instead. And you might find that just putting it in your diary, making a date to start being intimate, can help you reconnect with your partner. Now, many women have told me that getting their husbands to read the chapter on sex in my book, The Complete Guide to Breast Cancer, or listening to the episode about sex in my podcast, Don't Ignore the Elephant, and I'll put links in the descriptions, has been a huge help, because their partners finally understood why our libido takes a running jump. It's really hard to explain to your husband that it's not that you don't fancy them anymore, you just don't get turned on. And by them understanding and reading it from someone else's point of view, it can help them realise that it's not your fault, it's not their fault. So, can you actually have pain-free penetrative sex again? You can, but you might need to do it differently. And this is why, without estrogen to lubricate your vagina, it can become dry and painful, almost like a tube lined with sandpaper. And this means that having sex and having a wee can become really painful. The first thing you should use is lubricant. In fact, everyone should use lubricant. Lubricant is really important, but you need to make sure that you use one that doesn't have any added chemicals, parabens or glycerin that can cause thrush. I love these two water-based lubricants, Yes and Sutil. And Yes also comes as an oil-based formula which is safe with condoms. It's for vaginal and anal use. Some people use Silk, which is silicone-based, but I find it goes everywhere and doesn't stay where I want it. Yes also do an internal vaginal moisturiser that you can squeeze inside, and this is great if you have cystitis. The second thing you might need to consider is stretching. Your vagina is a muscular tube, and if you don't use it regularly, it can get sore and tight, just like your legs if you don't stretch them. And that's where using a small bullet vibrator or a silicone dilator, like these. You can pop these in with some lubricant when you're masturbating. You can use them in the shower. They go up to bigger sizes and they can just help gently stretch the vagina to get it ready for penetration. Finally, I'm going to talk about vaginal estrogen. Studies have shown that this is safe to use if you're on tamoxifen, and I wish every woman being put on tamoxifen was told that she can have it. There is enough evidence now to show that it does not increase the risk of recurrence and it is safe to use. There are vaginal pessaries that you can get. They come as a very small tablet and a little applicator that you just pop inside your vagina with a little bit of lube if you need it, and you can use these 2 or 3 times a week. Another option is a little vaginal ring implant that you can put in for 3 months. A lot of doctors are still really anxious about prescribing vaginal estrogen, but go to them, tell them it's safe, keep pushing this because it can make a massive, massive difference to your genitourinary health. Finally, if you're still struggling, here are a list of questions you can ask your doctor. And the first is, can I have a treatment break? Sometimes stopping tamoxifen for 4 to 6 weeks can just help you have a breather and then go back to keep taking it for the rest of the year, especially if you've got something important coming up like a wedding or a holiday. Most of us are quite happy to do it. You can also ask your doctor, do you still need to take it? If you've been on it for a couple of years and you're still struggling, your doctor can work out your risk of recurrence and what the benefit of tamoxifen is for you. And they may say, actually, you've been on it for long enough, it's okay to stop it. The third question to ask is, can you reduce the dose? Now, all the breast cancer studies have been done with 20 milligrams of tamoxifen. There's no real trial data for women with ER-positive breast cancer on the lower dose, but it could be something that your oncologist considers just to help you keep taking the tablets and make life a little bit easier for you. If you do reduce the dose or stop taking it, it's really important that you do those other things to further reduce your risk of recurrence, like cutting down alcohol, exercising regularly, and trying to keep your weight in a healthy range for your height. Now, here's the bonus tip. If everything else has failed, this is what you can do. And it's controversial, and I didn't believe it myself when my patients told me it worked for them. And then I tried it for myself, and oh my God! So what's the secret? Ask your pharmacist to give you a different brand. I know, it's crazy, right? It's still the same drug at the same strength, so there shouldn't be any difference in the side effects, and I can't explain why it works, but it might be worth a try. That's it for today. Thanks for watching. Remember to subscribe, and I'll see you next week.